childhood experiences, and the odds are good that you know someone who has suffered from one. Those experiences can lead to poor health throughout life and even to a premature death. But a new House bill is working to change that. Meg Shaw explains how it works and why it is important.
Adverse childhood experiences, also known as ACEs. It's more common than you think. According to the CDC, roughly 60% of adults surveyed across 25 states reported having experienced at least one type of ACE. Some examples include living with someone who has an alcohol or drug problem, emotional, physical, or sexual abuse, or neglect.
That's what our commission is going to find out. Why are we so low in addressing this, and why are our statistics so high?
But just this week, the Ohio House passed Bill 428, which would create the Adverse Childhood Experiences Study Commission.
We have heard that call and feel that the best place to start is to set up a commission to study this, and that will provide an annual report back to our legislators to be able to propose policy and legislation designed to really help Ohio's children.
State Representative Gail Pavliga, representing Portage County, tells us
it is so well supported by organizations all across Ohio.
If it's passed by the Ohio Senate, a committee will then begin compiling data about Ohio's children and their experiences with ACEs.
Those who deal with incarceration, mental health, schools, and the experts that we feel we need to gather the data. That data will then be compiled into a report that will be given annually.
So then professionals can begin to attack the issue and ultimately prevent it from happening.
We want people to be happy, and when one is faced with much trauma, mental illness, and other things that have happened, due to what has happened to them in their younger years, it's a loss to all of us, but especially that individual.
Representative Pavliga anticipates the Senate to pass the bill and the commission can begin their work later this year. For News 5, I'm Meg Shaw.
And here's why addressing those issues is very important. Ohio ranks higher than the national average for children who experience ACEs. And according to health policy in Ohio, they tend to disproportionately affect Ohioans of color and people with low income or disabilities. But if ACEs were eliminated in Ohio, an estimated 36% of depression diagnoses could be prevented.